name's Vishwa. I'm gonna be taking care of you today, okay?
Okay.
What's your name and how old are you?
I'm Natalie and I'm 5 years old.
Okay, so you probably still have your 20 primary teeth, correct?
Mm-hmm.
Okay, so I am today going to show you, well, you're gonna show me how do you brush your teeth in general. Every day. What does your brushing method look like? How do you do look like inside of your mouth as well? Okay, well that's a good start. I'm going to show you a technique. It's called the Fones method of brushing, used for people with primary teeth, so anybody under the age of 6. Okay, so we're gonna go all around. I like to start on the right. Okay. You basically put this and then you go into a circular motion, like all the way around. So you're gonna go around and then your facials. So I like to do this and then you kind of just brush, and then you can also open and then go like this to each of your teeth, okay? But I start off with doing this, and then you open your mouth and then do all the occlusals, which is also going to be circular method all the way around. With your anterior teeth, I like to do inside and then you just brush circular all around. Does that make sense?
Mm-hmm.
That's your lowers. For your uppers, you do this and then you just go circular motions. For anteriors, sorry, I find it hard to do on a model, but you do circular, and then I like to do. And lastly is going to be your occlusal, so just all around, and then, or lingual, my bad. You're gonna do the same thing, so facial, all the lingual surfaces, and same thing. You're gonna go lingual, and I like to do. Does that make sense? You want to do circular with your jaw closed and then open, and also do of each arch.
Okay.
So if you would like to show me that. Correct. So you do that all around. You want to do jaw closed and then open, lingual, and occlusal surfaces as well. Correct.
Do it on the top too?
If yes, I would like you to practice. I know this is difficult on a model. But it's basically just circular motions, all surfaces, occlusal, buccal, facial, and lingual. You're doing a great job. I know this is tough, but you do this twice a day, morning and night, you'll get better over time. Okay, that is great. Do you have any questions for me?
No.
No? Great. All done. Okay, I just wanted to go ahead and give some background on Alfred Fones and the Fones method of brushing. So this technique was invented back in 1913 by Alfred Fones, and Alfred Fones is also the father of dental hygiene. So he invented this motion, and it's basically described as you put your toothbrush against your gums and then you go in a circular motion. It doesn't have to be at a specific angle. You go around 4 to 5 times on each, or 4 to 5 times on each quadrant. So this method is only supposed to be used by children, but not all ages, only children with their primary set of teeth. So if you have mixed dentition or permanent dentition, it is not recommended that you brush this way. And I did show an example earlier, but I wanted to do another close-up example of this type of brushing. So I have my model. This one's missing a few teeth. It's an old one, but I just want to go ahead and show a close-up of it. So you take, let's say this is a patient or your mouth, you want to put your toothbrush against and then you go in a circular motion. So you're supposed gently 4 to 5 times each quadrant. So you want to do this, and then you want to get all surfaces, so lingual, buccal, facial, and occlusal. So this is going to be for the buccal and facial. So basically just this way, gently all around. And let's say I'm gonna show occlusal and lingual as well. So if it's open, I'm gonna start off occlusal first. You just wanna go circular motions all around. I know my model is again missing one tooth on that side, and when you go anterior, you want to go towards lingual and back to occlusal on this side. Same thing for your upper, so if I were to start here, you just kind of go, but it's going to be circular. And then anterior, you can always just, I find this hard to do on a model. And then I can do lingually and circular motions. And lastly, I'm just gonna do linguals. So you want to do linguals, go inside, and that is the lowers. Same thing for your uppers. You go lingual, and you will just go in a circular motion. So